Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I am the CNO editor for Health Leaders. Today, we are speaking with Patty Donley, who is the Senior Vice President and Chief Nursing Executive at WellSpan Health, about the organization's workplace violence prevention efforts. So, hi, Patty, how are you?
Hi, G. I'm great. Thank you. Thank you for having me today.
Of course. It's great to see you again. So this is a very hot button issue, as I'm sure you and all of our listeners know. But I wanted to take a little bit of a different angle at the top here and ask you, what are some of the biggest misconceptions about the reality of workplace violence in healthcare, and particularly nursing as well?
I think maybe two things come to mind with this, G. I think first off, I wonder what the public perception is related to the amount of workplace violence that our nurses and other team members face each day. You know, we often see the headlines, we see the tragic events that occur, but I'm not sure that everyone is aware of the frequency by which our team members face workplace violence issues at all levels and all scales within our healthcare environment. So I think that would be number one. And then number two is that no singular solution. I think a misconception is that you put this thing in place and it's going to prevent workplace violence, but there really is no singular solution to prevent the violence, where instead it takes a comprehensive assessment, a comprehensive plan to assure that you're addressing the complexity with which we see these events occurring. So I think those are the kind of the two big things that come to mind. And I'm not sure if you've felt any of those, especially the again, the propensity of the violence that we see compared to maybe what that public perception is, has been something that I've thought about recently.
Absolutely. I mean, from my perspective as a journalist, obviously I get to, report on it a lot. So I think I have probably a better understanding of the frequency than the average person would do. But it's a lot, and part of, my work here at Health Leaders is to kind of get that information out there, because it is a startling amount of workplace violence incidents that nurses go through. So we're going to get into some solutions in a moment here, but what are some strategies that you found that don't work in workplace violence prevention?
I think just based on our recent last, not even recent, but last several year approach is again back to that. It takes a complex plan in order to begin to see impact. And so I think what doesn't work is saying I'm going to put in weapons detection and that's going to prevent workplace violence, or I'm going to insert education and that's going to prevent workplace violence. I think that what you truly need is that comprehensive assessment and ability to have a multi-pronged plan that will enable your teams and maybe not even prevent incidents, but have your teams feel safer because you're able to react more quickly to incidents as they occur.
Mm-hmm. So, WellSpan Health saw I think it was 66% reduction in workplace violence related DART, which is days away, restricted, or transferred. So I wanted to ask you, how was that achieved? Because that's extremely impressive.
It is. It was actually, just to kind of clarify a little bit, the data that I looked at, it was actually a 62% reduction in specifically the workplace violence DART events. And I think it goes back to what I referenced. So as we did that comprehensive assessment, there's a couple things that we put in place. First is we did install what we're calling the canopy buttons, or the immediate panic, security activation buttons. And so what that did was, first off, gave our team members an immediate response to an event that was occurring. However, in isolation, that may not help to completely prevent issues. And so the other things on top of that included extensive training. So we took a training approach where we looked at every role within our organization, and we had full executive support of this, to say we needed to provide in-person training annually for those who were most likely to face, different kind of events like this. And so it ranged from our security team to our frontline nurses to our behavioral health team members, all receiving qualified in-person training on how to de-escalate people who are beginning to show signs of potential violence. So if you look at this holistically, what we did was we wanted to make sure our team members were first equipped with how to see signs of escalation and de-escalate them. We created a process by which a call can be made for immediate support to come to you. That includes security support, behavioral health support, supervisory support. So I'm in a situation, I'm seeing that someone is escalating, I'm starting to de-escalate, but I'm also getting some support to come in. And if that does not de-escalate, and or if you're suddenly threatened, then you also have the button that you can press to have, additional resources coming to you. So I think that approach was really helpful, so that what we saw was, what's great is when you put these plans in place and then you talk to people to say, what's working right now? How's it working? And I just remember rounding with team members about a year or two ago, as I asked, it was security team, what's working? They said, this training is making a complete difference, because you can provide education. If it's like online education or something like that, it's one thing. But when you're in practicing how to do this, that's really how you increase the competency of your team. So what we saw was that we were able to de-escalate a lot of situations before we even had to press the badge. But then once the badge is pressed and you have immediate people descending, to where you are, then it allowed us to more quickly prevent an injury from happening. So that's the whole goal of this, is to prevent an injury from ever occurring. And by first trying to de-escalate and then getting the right people on board, I think is what helped us to get there. So.
Mhm. Absolutely. So, just two little quick follow-up questions. What does that training kind of look like? And also, is it security teams that are arriving when the button is pressed, or what sort of resources are showing up for that?
So we have what's called a BERT call, which is Behavioral Emergency Response Team.
Okay.
So the response team is a multidisciplinary team that will come if you're not at the point where you're feeling like you are having an impending threat, but that someone's escalating and you might just need some support to de-escalate. So this team comes, they each have been trained in their roles on how to de-escalate based on their role. And so something that we found is very important is that sometimes, depending on the person, security may not be the first one to come into the room, because that can sometimes just escalate someone. And so what we found is that we have almost an order of things depending on the situation that's happening and the threat that's existing. But sometimes we might have a behavioral health team member come in and start de-escalation. Sometimes, depending on the person, you may want a certain gender of a person to come in. So it's all really defined, and it's defined within our training, which is helpful. So what that training looks like is actually in person. They come on site, we have qualified trainers doing it, and then we start talking through those kind of strategies, so that based on how a person is reacting, based on their history, what we found is that somebody might have a history where they react strongly to a certain type of person, and so we're mindful of that on who comes in to help to de-escalate. And so it's been a very comprehensive and I think research-based approach to say, how do we de-escalate people? And then when you are at the point of pressing the button, that's security. That's all in safety, who comes in and who can help to keep everyone in the environment safe.
Mm-hmm. Absolutely. So I know that the success for this initiative was measured with the DART metrics, but what are some other metrics that leaders can use to track prevention strategy wins?
There are a lot of metrics actually we track with this outside of just the DART. So we look at different things. So we'll evaluate how many times are we calling the BERT? How many BERT calls do we have? And then how many of the activations do we have with the canopy button? So if we start to see that the BERTs are going down and the canopies are going up, it may tell us that our training needs to be improved. So it's kind of a measure of how effective your training is.
Mm-hmm.
So that's been an important one, and especially looking to see, did we try a BERT before the canopy, or did someone escalate so quickly we needed it? It just helps us to understand the issues that are there. I think the other things that we look at every single day is how many activations do we have that are handled by security? How many activations are handled prior to security? So we track all of that data. We look at analytics related to canopy response time. So that's the button. So how quickly can we get people to the bedside? And then really creating detailed data around the incidents that happened, what were the precursors, what were the things that happened. And so it's when you have each of these data elements that you can really put together, where's your program working? Where do you have better opportunity? Are you seeing activations on a Tuesday night at 6 or something? Like, is something happening at that point? So it's really interesting when you start digging into the analytics of the data that can be produced through both the canopy and then our own individual reports of the birth calls.
Mm-hmm. Absolutely. And I'm sure it feeds into, like you're saying, that multi-pronged approach as well.
Absolutely.
Yeah. So what are some other strategies that leverage technology for violence prevention? I know you have the canopy buttons, but what are some other options that are out there?
You know, I was meeting recently with with our director, our VP head of public safety. And, you know, when you think about it, or when we were thinking about it, almost every piece of our plan has some kind of tech involved. So you look at things like body cameras, which we're starting to implement in certain situations, or you look at camera systems that can now generate AI and things that enable you to see this person's, you know, maybe someone at risk. We have things, new systems in place around visitor management, so that, you know, we're using software to detect and make sure we're tracking who comes into our facilities. You look at access controls and making sure we have appropriate access controls within our organization. And actually, just this isn't tech, but the number of access points we have for people who can enter our hospitals. I come from a community hospital, you know, worked in a hospital where I grew up. And sometimes it's hard to think that we need to do these kind of measures, but it's so important for the safety of our team and for our patients that we really are mindful about access points, about access control. How do we close down access if we need to? And then, of course, implementing things like weapons detection, you know, all of that. Just the technology that continues to grow in this space is pretty incredible. And it's important that we evaluate how it can continue to help promote a safe environment for our teams and our patients.
Absolutely. And I know you mentioned the nurse reaction a little bit to this program already, but how do you kind of bridge the gap with patients with technology like that? Because I imagine there might be a little bit of hesitation around it. So how do you
And
open
it goes
that?
back, really goes back to that public perception. Because I think,
Mhm.
you know, I talk to our community members who say to me, I can't believe I have to go through weapons detection in our community hospital. You know,
Mhm.
they aren't, I think, facing it each day. And sometimes it just involves educating the public, talking with them, you know, letting them know we're looking to keep you safe and us safe, and that it's just precautionary. It's something that we want to make sure we're doing to keep all of our team members safe and our community safe when they enter our buildings. But you're right, it is challenging, especially when you reduce entrance sites, because that is sometimes an inconvenience. So we tried to do extra things, certainly extra signage to point to where they can park, opened up closer parking spaces to the front, all of that to make it more convenient for our community members to use the access sites that we have opened. So.
Absolutely. Yeah, so this is all fantastic, and I'm really excited to see WellSpan continue this work. And my last question for you is, do you have any advice for other CNOs who might want to implement any sort of similar strategies?
Well, you know, I think about it probably was maybe 4 years ago or so. I remember talking to nurses in our emergency department when I was rounding. And we had new graduates who were doing a residency project, you know, saying, what are the things that we should be mindful of using evidence and research to evaluate the care that we provide to our patients? And they came to me and said, you know, Patty, I think we need a security activation button. I really think it's going to help us get help quickly, because there are times I'm in a room, I can't reach my phone, I can't pull it out. You know, I'm trying to manage a patient, and if I had this button, it would work. And as I look back and remember escalating it, I think that listening to our teams, because, you know, where the public doesn't maybe understand what we face each day, it's probably the same with me. I'm not the one dealing with the altercations each day. And so really listening and understanding and trying to put in place strategies that will truly make people feel safer and be safer. And I think second to that is just is developing a really strong communication plan, because even if we do 10 things, there's still a bit of risk. And so
Yeah.
we have to continue to communicate back with our teams why we're doing things like closing entrances, why we're implementing weapons detection, why part of it also is this extensive training where they go off site and they spend a full day learning how to de-escalate. And so that they know that first off, that their safety is our number one priority. And number two, that we're listening to the feedback that they have related to what else we could do. And that does become part of our conversations with rounding. So what else? What other things are you seeing that we should consider? And can you implement all of them? Not always, but hopefully if we continue to prioritize those that we think will be most effective, we'll not only be able to keep those channels of communication open, but provide a safer environment where they have input into the measures that we put in place.
Absolutely. Well, thank you so much, Patty, for your time. I'm grateful to have had this opportunity to hear your insights and talk to you again. And thank you so much to
Thank you for
our,
having me. It's an absolute privilege. Thank you.
of course, thank you so much.